So you might have heard of dry needling from a friend or family member, or maybe your own physical therapist, or may have read it on Dr. Google. Both Abbie and I are physical therapists and do this pretty much at least once a day when we're in the clinic on one of the patients that we're seeing. Sometimes it's more, sometimes it's less, but we do use this technique regularly in the clinic and have found it helpful.
So one of the biggest questions we get asked by patients is it acupuncture? The short answer is no. We do use the same needles as acupuncture. However, it targets a little bit different. So the idea behind acupuncture, it follows an energy system, certain chi lines, and was established and founded well over hundreds of years ago and has been typical Western and Chinese medicine. Whereas dry needling, it targets muscles and it uses those muscles in a little bit more specific ways rather than a chi and energy system to target those muscles.
Yeah, so it's like essentially we are thinking this muscle is contributing to your discomfort, pain, etc. So we are going to needle that muscle to either calm it down, activate it, etc. So we'll kind of dive into that a little bit more later. Essentially how it came about was, we obviously knew about acupuncture because that's been going on for a long time, but they were doing research studies on actual injections, and for a comparison for research, you have the actual intervention and you have a sham intervention, and they were doing an injection without anything in it. So they were just sticking them with a needle and then that was it. So they didn't inject anything, it had no medication or anything like that. And they realized that sham group actually did have some improvement. So then they started doing research on I think they just did not even sticking the skin, but like a poke almost with something like sharp that doesn't break the skin, and then like an actual needle, and then kind of played around with the needle size and did find that the acupuncture needles did produce an effect in the muscle by themselves without any medication. So that's where the term dry needling came in. Dry as in no medication.
All right, so what does dry needling do? Like Laura said, the number one thing that it typically is thought to do is it calms the muscle down. So this can be to help with muscular pain or muscular referrals, but basically to stimulate that muscle so it has less of a pain response.
It can also be used to improve range of motion. So when that muscle is tight, the stimulus of the needle going in can help those muscles to relax, and that can then improve the motion. So let's say maybe your knee isn't bending, we can needle your quad, and that might, if the quad is limiting that knee bending, then it can improve that motion.
Another thing that it can be used for is muscle activation. So just like Laura was saying with the quad, say the quad is not firing very well after either surgery or just an injury in general, we can use dry needles to help stimulate and activate that muscle and to help it twitch and start creating more of that muscle to turn on.
Yep, and then you want to follow it up with exercises when that muscle is essentially I kind of say it almost as a mini reset of those muscle fibers, and then you can use exercise to follow that up, and so it can activate a little bit more and you can work on inspiring patterns. It can also be used so if you're having any nerve pain, for example, it can be used to relax the muscles around the pathway of that nerve, because nerves like blood flow, they like space and they like movement. So we can create a little bit more space because those muscles around that nerve might be tight, and reducing the space that nerve has to move. And so you can use the needling around the nerve, you're not actually needling the nerve, to then improve the space that it has and improve blood flow to that area as well.
Mm-hmm. Essentially opening up the pathway.
Yes.
So how does dry needling specifically work? So essentially we use the needle to create a stimulus going into the muscle. So kind of think of it as resetting the muscle, and those fibers are within the muscle. So you may get a twitch response with the muscle. So say you stick the needle in and it feels like it's wrapping around and tightening around that muscle, and that is what we call a twitch response. So this does not always happen, typically with our bigger muscle groups. It happens quite often.
I'd probably say upper trap is where you get it the most, but you can really get it in any muscle.
Yeah, so this can happen, but not always, and you don't need to have a twitch response for it to be effective.
a lot of people will wonder, like, so does this produce a long-term change? So all in all is not by itself. That's why following it up with exercise is really important. It can be used to allow you to do more exercises to tolerate and to address the issue. So maybe you're not able to tolerate a certain movement before the needling, and you can then improve the motion with the needling, and now you can do exercises throughout that to help maintain that motion and improve your body's tolerance to that motion. Or if you're strengthening it up, it might be we needle that muscle, get it to calm down, and then maybe we can use the exercise to get it going a little bit more, and then be able to tolerate that without any pain, essentially. So over time, you're going to need the needling less and less. Some people, honestly, it's one and done, but a lot of people do need it more often. And then you'll kind of wean off of it as your activity tolerance improves, essentially.
So when dry needling is done appropriately, you shouldn't need it forever. Like Laura said, it's just a means to address either the pain or limitations around that muscle and get it moving forward in the correct direction. Another question we get asked very frequently is this a safe technique? So
we wouldn't do it if it wasn't safe.
Yeah. The answer is yes. The risk for pretty much anything that we tell patients that is a risk factor is super, super low. So the risk for infection is super, super low. We wear gloves, we use alcohol swabs. The most common adverse events are typically soreness. Some patients can experience bruising.
But it's not like a normal bruise either. It's really you like hit a superficial like blood vessel, and it stops bleeding if you do bleed in like a couple seconds of like light pressure, and you don't even need a Band-Aid for it.
Yeah. And it's not a painful bruise either. It's more of a very
like
superficial
a visual thing.
Yeah.
So like if you were going to a wedding and we needled something in your arm and you're wearing a sleeveless dress, you might hold off on it just in case. But things like that. It's more of a cosmetic, I guess, bruise than anything. That makes sense.
Yeah. Another thing that can happen is soreness, but typically this lasts maybe 48 hours, and stretching, heat, and other activation of the muscles can help reduce this, and that is why we typically have patients exercise and stretch out that muscle after it is done.
Really, the most serious adverse event that might happen is a pneumothorax, which is essentially a punctured lung. But first of all, you have to consider, are you even going around that lung field? And really, honestly, if you're doing it right, it's not really anything to worry about. The incidence of that occurring is very, very low. And I feel like in the dry needling courses, they mainly said like, oh, it was like a student who was learning how to do it, and like someone doing something very stupid.
My teacher said in the 20 years that she has been doing dry needling, she has learned of one person that has caused a pneumothorax, and it was in the rib field and in between intercostals.
And really, so like you're very careful with those ones, and most muscles, it's not really a concern if you know what you're doing. And if your therapist is willing to dry needle you, they know what they're doing. So it's very minimal risk, essentially. Yeah. And so now we're going to go into how it's done. So Abbie, you want to do your back needles, correct?
Yeah.
Cool. So my husband grabbed gloves that are not my size. So we are using a little bit larger gloves, but that's okay. So we are essentially going to expose the area. So if you are like having your hip needled or something like that, we would expose the hip, and then we're just going to kind of wipe it down there. And then essentially what you can feel while we do it, some people feel nothing at all. Some people feel a little bit of a muscle cramp sensation. I would say most people feel a little bit of an ache that eases fairly quickly. But really, most of the time when I needle people, she just jumped quite a lot. Most of the time when I'm needling people for the first time, I will needle them and they'll go, "That was it?" And I'm like, "Yes, that is it." How was it gone? Good. How would you describe what you're feeling? Anything at all?
Almost like a dull, like if Laura's shoving her thumb into my back.
And then there
So
are
it's like
different,
almost like a deep tissue
and then
pressure.
there are different techniques that you can use with the needle. Some people will piston, which is kind of going in and out fairly quickly. Some people will line, some people won't do either one. It kind of depends on what you're feeling, what that therapist's preference is, and a ton of other factors as well. So that's more therapist judgment. And then you can also leave these needles in for a period of time. Like Abbie just got a little mini twitch response there, but I felt that you couldn't really see. But some people will leave them in, some people won't. Depending on the patient, I may or may not. So I'll often have them do like some diaphragmatic breathing for like the lower back while they're in, for example. And in certain places, I would leave these in, and in certain places, I would have my hand on it the whole entire time. I'm just going to kind of leave these in, let them sit for a little bit. You do or don't need to do this. Honestly, it really depends, like I mentioned. Keep in mind, depending on where you're living, your therapist may or may not be able to do this, right? So like in Georgia, for example, we can needle. You just have to have an additional certification for it. So depending on the therapist, they may or may not be able to needle. So like, for example, Oregon, they're not allowed. At the time of recording this video, they are not allowed to dry needle. So depending on where you are, it may or may not be allowed, and so you just call the clinic that you're thinking about going to and ask if there is a therapist there that can dry needle, and that can guide you if you want to seek care there, or see if there's another place nearby that might be able to do this for you if you do want it. But again, it's not necessarily, like, it can be a very helpful tool for some people, but it is also another tool in the toolbox. Fun fact, so there are physical therapists for animals, so like dogs, horses especially, and apparently they can needle. All good here. Abbie didn't even bleed or anything like that. And then voila, she is all done.
So I'm going to go ahead and needle Laura's upper trap next. This is typically done with a bunch of headaches, shoulder and scapular pain. I know, for instance, I get this done quite a bit because of my cervicogenic headaches, which we also have a video on, so we'll link that right up here for you guys to watch and go back and refer to. But as Laura said earlier, these gloves are also too big for me, but that is okay. So this can be done a couple different ways. I like to go in a prone position, so face down. But again, like Laura said, to mitigate that risk of a pneumothorax, I pull that upper trap away, okay, little poke, and then go into that upper trap. And you may be able to see that first twitch. Oh, there's another one. And with the upper traps, I do not leave the needles in. I typically piston it just a little bit, just because you can only be in for a little bit. And hopefully I'll be able to have her zoom in on that twitch, and you guys may be able to see it, because that did twitch several times, and still is. Go ahead and take that out. That already is a whole lot looser in tone. I think Laura's been a little stressed.
But overall, essentially, we use this technique a fair amount in the clinic. Again, it's not an end-all be-all, but it is another tool in the toolbox, and it is a helpful tool in our opinions. Again, it is a newer technique, so physical therapy in itself is a newer field, so the research needs to be improved in the field in general, and then dry needling is a newer technique. So again, more research is needed, but there is research out there showing that dry needling, in addition to exercise, can be helpful for outcomes. So that is partly why we use it, partly our experience, and again, patient preference is also going to play a huge role as well. So if you do think this is going to be helpful for you, it's more likely to be helpful too. So depending on all of those factors is going to go into the determination if we would use this technique or not. But let us know below if you do have any questions, if you've had needling before, and what your experience was. Go ahead and drop it in the comments below. But again, we will go ahead and link that cervicogenic headache video for you guys over here as well.
Awesome. Thanks, y'all.
Bye.
All right. Sorry.
Let's go. Okay. There is a potential a small risk for a pneumothorax. For a pneumothorax. Okay.